Good afternoon, everyone. Our webinar is going to begin. I'm Steve Love, President, CEO, Dallas-Fort Worth Hospital Council. We want to thank each of you for being here today. This is going to be an educational webinar that's hosted in coordination with the University of St. Augustine for Health Services, and they're an active associate member of the council. Today's topic is healthcare workforce shortage. We all know that's a timely topic in our industry, especially with the follow-up from COVID-19. This webinar is going to focus specifically on North Texas workforce shortages and specifically how it relates to occupational therapy, physical therapy, speech therapy, pathology, and nursing. It's going to highlight ways to impact these shortages by improving patient care and also job satisfaction. We're delighted that we've got guest speakers with us today from the University of St. Augustine for Health Sciences, including Dr. Ashley Meaux, who's the Assistant Program Director and Associate Professor of Speech and Language Pathology in their program. We also have with us Dr. Keith McWilliams, who's the Program Director, Occupational Therapy and Assistant Professor. And also, we've got with us Dr. Thomas Werner, the Program Director in the Physical Therapy Program. It's going to be a great discussion. We've actually had members here from the hospital camp visit their campus here in Irving, and it is really something that is fascinating. So we know that this discussion today is going to touch on some crucial issues here in North Texas and give us some workable solutions. So with that, ladies and gentlemen, I'm now going to turn it over to Ashley. Welcome, Ashley.
Thank you, Steve Love. We appreciate the time to spend with y'all this afternoon and to share with you USA's role in the North Texas region. And we have prepared for you guys a panel-style presentation. We will both share our screen, and myself, Drs. Werner and Drs. McWilliams will also will bounce ideas off of each other. First, we did want to say hello. That was a beautiful introduction, Steve. We did want to be able to say hello to each of you and really tell you what each of our roles are here at the university, and and what makes what I call our academic and clinical heartbeat. So yes, my name is Ashley Meaux. I'm an assistant program director for the speech language pathology program. We'll talk a little bit more about the program and how long it's been in our area. I'm also the campus director here on the Dallas campus, and we'll share with you as well how long we've been in this area and how we've intentionally put ourselves in this area for this one reason, the workforce shortage, and how we can answer to that as a university and through community partnerships with each of you. I'm gonna let Tom introduce himself, and then Keith.
Hey, thank you, Ashley. Hello, everyone. I'm Tom Werner, and I'm the Academic Program Director for the Doctor of Physical Therapy program at the university. I'm also Associate Professor. I've been with the university for, gosh, almost 11 years. I joined the university when we opened up our campus down there in Austin, Texas. And then I came up here to the Dallas-Fort Worth area at the close of 2018. And as Ashley mentioned, we'll be talking to you about our academic programs and really sharing with you too about our graduates and how we can best serve and help manage this shortage of healthcare providers here in North Texas. So hello, everyone. Dr. McWilliams.
Hello, yes, I'm Dr. Keith McWilliams. I'm the program director of the Doctor of Occupational Therapy programs here in Dallas, also assistant professor. I've been with the University of St. Augustine since we opened the doors here in North Texas. Very excited to be a part of this growing program, looking to launch more programs to add to our degrees that we offer here in the Dallas-Fort Worth area, to be able to contribute occupational therapists, physical therapists, and speech language pathologists to the community to be able to serve those in need. So I'm very excited to be here. Thank you.
Wonderful, gentlemen. So let's go ahead and get started. What we are going to share with you here is we would love to be able to share our mission as a university with you guys. Our mission at the University of St. Augustine for Health Sciences is the development of professional healthcare practitioners. You'll see this afternoon through innovative, individualized, and quality classroom, clinical, and distance education. Really, we're going to focus on those areas with you to really talk about not only the nationwide healthcare shortage, but also the North Texas healthcare shortage. And so I'll take those 2 points with us this afternoon. With the pandemic, as Steve had introduced earlier in this afternoon, with the pandemic, there's been a detrimental impact to the healthcare workforce, which has resulted in a pretty substantial workforce shortage. There's an estimated 230,000 physicians, nurse practitioners, physicians assistants, and other clinicians who have either quit their positions or have moved to other positions. And so you guys may have seen, those of you on the call with us this afternoon, you may have seen some of that fluidity in your own areas and people either switching jobs or even switching careers. And so we also are working through with the workforce shortages, things such as burnout, exhaustion, people have taken early retirement. And so each of these factors have really impacted and significantly contributed to the influx of healthcare workers that are quitting their jobs. And so we as a health science university are really working with our students and working with our faculty to be able to address through our core values how we are able to work with students and how we're able to, as you see here, our very last core value that is currently being adopted, that community engagement, how we can work with our students and the community to be able to address the workforce shortage in North Texas. Specifically in North Texas, the shortage of health science practitioners has continued to prevail. According to the Bureau of Labor and Statistics, employment in healthcare is projected to grow. And so that's one area that we'll talk to you guys about this afternoon and really share with USA how it is that we are training our students and how we are making the commitment to the community to train as well as retain our students in our area. I'll speak specifically to speech-language pathology workforce shortages, and then Tom, I'll turn it over to you for PT. How does that sound? All right, lovely. Speech pathology particularly continues to grow. In SLP, there is a critical shortage of SLPs. As we tell our students, there is not a shortage of positions for our students. And so with that lens, we are really through these innovative practices, innovative clinical teaching, really giving our students a diverse range of experiences to be able to work in a diverse range of areas across our fields. And so it is projected that there will be over 14,000 job openings for SLPs over the next decade, and that is what we are really training our students to be able to not only currently stay in our area, but also be mentors in our area as well. And so Tom and Keith, I know that y'all have some information too for PT and OT that you'd like to share with us this afternoon.
Great, thanks Ashley. Yeah, so similarly, we've seen this national physical therapy shortage, but we've also seen it particularly here in Texas. I think after the pandemic began, all of you, probably felt it as we did. Physical therapy wise, we have about 22,000 physical therapists, reportedly that had left the healthcare workforce. As Ashley mentioned, either because of maybe burnout, just maybe early retirements. The pandemic really did influence healthcare in a number of ways, and one was this workforce shortage that we're up against right now. The change in employment for physical therapists is really anticipated to grow as well, almost by 17% between now and 2031. So now that we have a shortage, but at the same time, we have a demand now for more physical therapists nationwide, and particularly in Texas. You know, Texas is one of the top states that really is showing one of the largest shortages of physical therapists. And so, you know, this led, you know, the University of St. Augustine to not only, you know, take a look at its programs and are we really preparing our students to enter practice with the needs and the demands that are being placed upon them now post-pandemic, including things like what we'll be talking a little bit later about, you know, telehealth, digital health, as you might hear it as well, but also here in the DFW area. You know, here in Texas, we see that the population is quickly growing. Many people are coming into the area, as we all know. We certainly have several of our rural areas that are really facing some hospital shortages and closures, I guess. I'm sure that all of you are well attuned to that, being here in the council. And also that there's just been an overall lack of healthcare in our rural areas in particular. You know, then we see these folks coming, you know, to the urban areas, you know, if there's no hospital or there aren't any services in their rural area. And then this too brings the need for greater healthcare workers, you know, here in sort of the metropolitan area of the DFW area. So we predict that, and as we know, by 2050, we'll probably see the number of people over age 65 nearly double. With people living longer, that means there's a longer period of time for many folks to have a compromised health or maybe a declining physical and cognitive capability for themselves. So that only increases, you know, the need for rehabilitative professions like physical therapy, and soon we'll hear from some Keith around occupational therapy, and as Ashley was saying too, in the speech language pathology and nursing areas. So Keith.
Yes, thank you. So as we know, Dallas-Fort Worth is one of the fastest growing areas within the United States, and that expands even beyond Dallas-Fort Worth to the greater North Texas area. We know that there is a shortage of therapists, but we know that there is growing need for therapists. So among other rehab health science professions, the employment of occupational therapists is projected to grow by 14% from now until 2031. And that's much faster than the average for all occupations. Occupational therapists play a vital role in treating a variety of illnesses and disabilities like neurodegenerative conditions, cerebral palsy, autism, spinal cord injury, acquired brain injury, or amputation. So there is a great need across the lifespan for occupational therapists to be in practice. And the need of occupational therapists specifically for our large baby boom generation will continue to grow because people remain active later in life and need to continue engaging in occupations in order to stay active and to stay fit. Occupational therapists also play a major role in helping patients to be discharged from healthcare facilities. So this opens up more room for incoming patients and then kind of decreasing some of the repeat visits for some of our clients that we serve.
Keith and Tom, I heard y'all say a few times, we were talking both about this North Texas region, the shortages in North Texas, as well as the coast to coast, the shortages through the US. And so for those of you joining us this afternoon, another really, another piece that we wanted to share with you guys is while we on the Dallas campus here at the University of St. Augustine for Health Sciences want to be able to train our students in our community so that we retain them in our community, we also wanted you all joining us this afternoon to know that at USA, we are one university, but we do have other campuses across the nation. And so we do say that we are coast to coast. And we really wanted to be able to share that with you guys because not only are there opportunities for OT, PT, and SLP here on the Dallas campus, and we are in conversation with nursing and Masters of Healthcare Administration, we have other programs here at the University of St. Augustine that can also, with your support and with the support of our community, maybe even answer to some of those other shortages other than the disciplines that Keith, Tom, and myself were in. And so you'll see that we have been around as a university since 1979. You'll hear us on the Dallas campus say that we were in this community since 2018. And so we came very intentionally to this area to be able to work with the community, to be able to attract the students that are in this area, to be able to answer to the shortages that are in our area for a number of reasons, particularly those that Tom had said about the aging population, and as Keith had said, to answer to the growing shortage in each of our professions. And so we really wanted you guys to be able to take away that we do have multiple programs here at USA. And so when we connect with you guys, we'd love to connect for our own programs, but also for the university at large. Our community will benefit from the entire university. And so some of the ways that we are doing that here as a Dallas campus is you'll see that we have you can see our current enrollment, you can see our growing enrollment, and really one of the hallmarks of of USA is our interprofessional education and our interprofessional collaboration. And so when we're thinking about things like patient care and job satisfaction, that's two different ways that we'll go with y'all this afternoon as well. And so when we think about interprofessional education, if you remember a slide ago, that's really at the hallmark of us at USA as a leader in rehabilitative practice. And so we really do work with each other and work with our students in an interprofessional education style of teaching. And that is one in which we have two or more professions. So very often you'll see on our campus that SLP, OT, and PT students and faculty are working together so that we can learn about, learn from, and learn with each other, so that we are able to have a greater impact and effective practice through that collaboration, so that we see that improvement in healthcare outcomes. And so here at USA, we are training healthcare practitioners who would be skilled in communicating and collaborating harmoniously with team members from other disciplines. So that's one of those areas that when we're thinking about the workforce shortage and we're thinking about our community, we're really thinking about how we train our students to not only really have that deep dive into their own practice, but also to have that lens and that wider view of each of our disciplines that are here at the university as well, so that we can impact our area, and greater impact to outcomes, So within, and you'll hear from Tom and Keith, within each of our curriculum, we have integrated IPE coursework. And we have done so through clinical simulations and have simulated activities across each of our programs. And so we're going to go into a little bit this afternoon about how it is that we train our students so that they can practice delivering a holistic and collaborative approach to safe healthcare, so that very early on in their practice, when they're going out into the field for clinical externships or internships, when you're hiring them into your practices, you really have that sense and you have that support that they are thinking not only about their own discipline, but also transcending across other disciplines as well. So we definitely will explore our curriculum, our simulation, and how our faculty really prepares each of our students for those pieces and the benefits of interprofessional education. And Tom, do you want to take us through some of those pieces for PT and interprofessional education training?
Yeah, sure thing. Thank you, Ashley. You know, the benefits of interprofessional education are far-reaching. You know, as Ashley mentioned, you know, here at the school, we intentionally bring the students together and the faculty together, you know, in the curriculum with the particulars around interprofessional educational experiences. Now, the far-reaching piece is that as we all know, interprofessional education benefits not only the practitioner, but it truly benefits the patient or the client. Because as we know, healthcare and the effectiveness of healthcare of the future is really dependent upon a well integrated and collaborative healthcare team. So, from a decade or more ago, we often saw the healthcare practitioner somewhat working in a silo, even sharing information from one practitioner to the other through our EMR systems. Today we have even grand EMR systems encrypted so that we can use and pass information between practitioners. But still, that's not the only way, that we can stay connected, but to really work together. Sometimes, here at the school, we'll have a PT student with an OT student working in a room with a client, and then maybe a speech language pathology student will come in to the scenario as well, and then how all three, let's say at the bedside, can be working together. I think as Ashley was indicating, implementing interprofessional educational experiences in the curriculum is new, I would say, within the last decade. But here at the university, we specifically think about our educational model from the didactic experiences that we see in all programs to sort of laboratory practice sessions to then the third step simulation before then the student actually goes out into your settings on an externship or an internship or a fieldwork experience. So I think to really create interprofessional education intentionally, really helps transform the culture of healthcare, really allows us to step forward, to collaborate with you on stepping forward, to build a healthcare environment here in the North Texas area that truly values the teamwork and sees that teamwork as a collective to being very effective and improving patient outcomes. This interprofessional education, really promotes a mutual understanding between the professions, where the professionals can understand the roles and responsibilities, some of the ethical responsibilities that are there that are different a little bit sometimes between teams and individual practice. And certainly then, undoubtedly, problem solving. Problem solving as a team will always help the healthcare delivery more than problem solving as a solo practitioner. So we've got plenty of evidence around that, and I'm sure you're well versed in that as well. I know Keith has a few more things to share about this as well. Keith.
Yeah, so kind of as the saying goes, when you do what you love, you'll never work a day in your life, but it also includes when you love the people you work with. That really makes an impact. And we know that interprofessional education has the ability to address the workforce shortage by increasing job satisfaction. People have to love what they do, but they also have to love going to work and being there and working with one another and feeling a part of a team and being able to collaborate and ultimately benefit the patient who's a part of that circle and part of that interprofessional education. We know that this can help to decrease burnout, and as I mentioned, it increases the job satisfaction by providing better and more efficient care. When everyone has an idea of the role that they play, but also an understanding of the role that others play, ultimately the patient and the community are the ones who benefit from this excellent collaboration. So by cooperating with other healthcare professionals to treat, to diagnose, again, the patient is the one who benefits from that, as opposed to one person feeling like they need to take everything on their shoulders. It's so important for therapists, for physicians, for physician assistants, nurses, to all work together and to feel that they are a part of a team. Ultimately, as I've mentioned, the patient is the one who benefits from that type of collaboration, and that's what we are trying to teach our students.
Gentlemen, I heard both of y'all say we were talking we talked about each of our disciplines, and we talked about how it is that we are working with our students in that interprofessional collaborative piece to to the workforce shortage, but I've heard y'all say several times over job satisfaction and working with patients. And this really is one of those pieces that I wanted to give us an opportunity to, that while we are talking about workforce shortage with y'all this afternoon, we also wanted to share what we are doing to be able to give to the community as well, because when there's a workforce shortage, I won't say that 3 times, but when there's a workforce shortage, there's also a shortage of clinicians to provide services. And so one area that we are starting here in 2024 is we are starting here a pro bono clinic. So I can speak a little bit to SLP, where in 2020, when COVID hit and things shut down, SLP reached out to the university and said, hey, we have been putting together a pro bono telehealth clinic model. Would we be able to get the support to be able to start the pro bono telehealth clinic, because our students are primarily coast to coast. They're asynchronous and come to campus for some experiences. And so we have started a telehealth clinic, and the telehealth clinic sees over 120 of our clients in the Texas region, the state of Texas. And so Keith and Tom, I know that you guys are also starting to bring that pro bono clinic experience here to Dallas as well, to be able to support people that are in our community due to the workforce shortage. I don't know if y'all want to talk to us a little bit about that pro bono clinic.
Yeah, thank you, Ashley. I think you said something very interesting there, and I think it was by Keith as well about the shortage following the pandemic, and it was a very stressful time. And as we were talking about earlier, we had people leave following the pandemic because of burnout, because of job satisfaction. It was a very trying time in history for healthcare here in the United States and around the world. But I think one of the things we want to do now at the university is maybe like sort of another phase, now that we have emerged from the pandemic as well as an educational institution, is to build more relationships in the community. And one of those is we're putting our heads together, so to say, and looking at our resources, how we can expand our pro bono services, not only from telehealth, telerehabilitation, but also have in-person pro bono clinic. And in order for us to do that is, one, put that together from our side with our faculty and students, very student-led, student-driven, along with faculty guidance. But we're going to need to find contacts in the community that we can work with who may have patients and clients who simply don't have any healthcare coverage anymore, don't have the means, but they still have the need for healthcare. And if we can provide them that pro bono service and really role model what we're teaching, that interprofessional, that collaboration, that team-based treatment, I think it's going to be wonderful for us here in the community. I know, Keith, you might have some words about that too, because I think you guys have been doing some great work in this area already in the community.
Yeah, so we were able to partner with the speech language pathology program just after they started doing the telehealth pro bono clinic to be able to specifically focus on pediatrics. We would like to expand this to have the in-person. I know in my personal experience working in acquired brain injury, there were always those times when a patient, was forced into discharge and wasn't quite finished with their therapy. And the therapist always felt, oh, they could just do a little bit more if we just had a little bit more time. So we're hoping that this makes an impact on the community by us being able to offer a service to those who maybe don't have healthcare coverage and those that do need those check-ins after they have been discharged, and maybe it's 3 months down the road and they want to come in and get an evaluation. I know that most of our hospital systems and physicians have patients come in and think they need more, think they just need a little bit more treatment, and so maybe this is an option for the community that we will be able to provide and fill that need.
And this is really a testament to, as I'll continue to move us along this afternoon, this is really a testament to USA leading, educating the next generation of health science professionals. You all can see here this juxtaposition of our total enrollment at USA, and then we pulled out the Dallas campus for you guys, because again, we really want to be able to share with you all that while we do have our campus here and we have our students that are here on this campus, we also have students that are interested in coming to our community for their clinical practice. They are also keeping their eyes on, keeping their sights on this North Dallas region to be able to relocate and come to this area. So what we're talking about today with the workforce shortage, our students are really in tune to that. They get their training and they want to be able to go to communities where they can have an impact, where they can really be able to support folks in a community environment. And so one thing that we've talked about today is we talked about burnout, we've talked about retiring. And so with those pieces, with burnout, with retirement, it's really looking at, I think Keith and Tom, y'all both said this, it's really looking at training the next generation. How is the next generation going to be trained for healthcare? And how is the next generation going to not only be able to be a practitioner, but also a mentor and be able to practice across different environments? And so it's really crucial that the incoming and aspiring healthcare professionals have access to education and training program. And that's one piece that really, I know, makes my heart flutter, is this connection that we have with you guys in our community, because we are so very excited to be able to work with our community partners to be able to spread those positive healthcare benefits across the area. And this education and training, the education and training programs that we have here provide that additional access to communities, as you saw with the telehealth clinic, as you see is coming our way with the pro bono clinic as well. And in a few moments, we'll definitely share the, you know what, I can go there now, gentlemen. Let's go ahead and move into our educational learning model. Tom, I heard you start us off with it, where you were talking about the didactic, the three area and components. Do you actually want to start us off with the educational learning model at USA and how that's addressing the workforce shortage in our area?
Yeah, wonderful. Thanks, Ashley. Yeah, so, you know, taking a look at some of these pictures right here, you know, in education, you know, we use the word didactic. Think of that as, you know, maybe your typical, you know, textbook, podcast, video, lectures, things like that, where students are engaging and really getting a first, you know, their first glimpse and first connection into the knowledge that they need, you know, to become a great practitioner. Then we take that knowledge and make application of that really in the lab. So you might see something like the picture on the top right, the other picture there on the top left, and so forth, where students are working then with faculty, you know, in the laboratory experience here at the Dallas campus and at all of our campus, but particularly at the Dallas campus, we've been fortunate enough to really bring technology into the classroom and into the laboratory experiences. That picture on the center left, or center picture on the top, let's put it that way, you know, really shows anatomage.com anatomage tables, where each of these tables have two large CPU processors and each with 4 cadavers that have been digitized in many ways. So students learn how to dissect in a very 3D, high-tech, you know, environment. But then dropping down to the bottom picture in the center there, that is actually classroom. That's our simulated experience. A nice example of that might look like, wow, that looks maybe like acute care, you know, bed number 735 at one of your hospitals or something like that. We have on our campus a simulated center, and part of that center is this acute care unit of 8 beds set out to expand then to 10 beds. So we have an opportunity for the students to involve themselves in a simulated experience of team-based care. Now, what's interesting is the individual in the bed is one of our standardized patients. So we begin to work with members of the community who may come on in to the campus and play particular roles. It's wonderful to work with those with a theatrical background, or even some of our theater groups in town, where they can come on in and play these roles. And in this case, this individual is playing a role of someone you can see, I can tell you they have a wig on, and they're playing that role of maybe somebody who's in that aging population. So we allow that, we have that going on. So that's like step 3 in the process. And then of course, step 4 is then getting out into the hospital settings and things like that. Ashley, you want me to talk a little bit about the shortage for PT in particular with sites in the area, or should we save that for a little bit later, or where are we at with that?
Yeah, you know what, Tom, we can definitely, we can come to that. I have the next slide, we'll talk about PT training, all of our training in the area. I definitely wanted to, Tom, you brought up really good points about each of these areas in our training, from the didactic, hands-on, then simulation and externship. And so one thing I wanted to be able to offer from the SLP perspective is really our students here at USA have experiences that are really beyond other training, clinical training programs that I've seen. And I really wanted to focus on that clinical training aspect. Because Tom, Keith, and I, the 3 of us have said things like our faculty and our students, but our faculty and our students are all clinicians at heart, and our faculty are clinicians in actual practice as well. And so I think that's a really unique quality here too at USA, because I look at these pictures and I see our students, I see our faculty, and I think about my faculty member that's here and how she's training our students, how she does PRN work, and she's really connected with the community and connected with current practice and what is current best evidence, and how we at USA are really innovative in how we structure our curriculum and our programs to fluently move our students from the didactic pieces to give them hands-on experiences and that constant feedback loop through these hands-on pieces in the classroom, as you see, to then go down to, like Tom said, that middle part of the slide about the simulations. And this is a bedside swallow study that they're doing, and it's created a simulation created by simulation education experts who have training in creating simulations, actors and actresses who are trained in being able to provide the simulated experience. And our students really do show up, as you see, in scrubs, and they are really trained in that environment so that when they go out to externship, they come with that experience. And I think as we're thinking about workforce shortage and we think about burnout, we think about what students need to know about what their world's going to look like out in the field, we are really able to simulate that for them so that they are able to talk to their faculty and say, what's that really like out there? They're able to be in a simulated experience, have that high stakes experience, be able to bounce ideas off each other, off of the faculty, off of the clinical educators before going out into the field. Keith, do you have anything, Keith or Tom, anything to add to that effect as well?
Yeah, I think one of the most important things about these simulations is the experience that our students are gaining. When they do go into a patient's room for the first day, meet with a client for the first time, they feel as though they've been there before, that they have the experience and they have the confidence, most importantly, to feel that they are competent in what they're doing. This helps our students to be able to easily transition from the classroom to their clinical affiliations and then into their job as a practitioner. That having that experience is crucial for our students.
And I might just add, hopefully you're hearing the message that, you know, with USA making a decision to be here in the DFW area because of the shortage and because of the need for another educational program, that you're hearing that we're here to really address this shortage by really developing through our educational learning model a really strong pipeline of practitioners who upon graduation are there for you to hire and help manage that shortage and fill that shortage there in your hospitals here in the DFW area.
Yes, indeed. And Tom, you started to take us down a path too that I really want us to be able to focus on. And that is the path of, as we talked about, you know, the didactic hands-on simulation externship. Let's take a little bit of that dive into the externship where our students are getting that after all this training, our students are going out into the community. And so Tom, you lead us here with what the landscape looks like for your students in our area, what our students are asking for, et cetera. I'd love to hear a little bit more about that from you.
Yeah, so here's where that partnership, here's where our intention is, you know, with us working closely with all of you, is that now in physical therapy, we graduated our first cohort just a few months ago, April 2023. April 2023. Now, every one of these students has 3 internship experiences as part of their program before they then, you know, sit for their board exams and become a licensed practitioner. Interestingly enough, I pulled up a few statistics, and in the DFW area, within 50 miles of the school, we have approximately 411 clinical sites. 411 clinical sites. 212 of those clinical sites, though, are in the acute care or a setting where our students have exposure and an opportunity to work with clinical instructors managing the medically complex patient. So that's many of you there in your hospitals. Let's say put it that way. Out of those 212 sites, 15 to 20 of those sites gave us an offer of either 1 or 2 each year. And we graduate between 45 and 60 students once a year. And interesting enough, 99% of our students would like to have an experience here locally. But if we don't have those offers from you guys, you know, we can't meet that need of those students wanting to internship here. And then hopefully they'll enjoy that experience and become an employee of yours there in your hospital, let's say, so that then they and us are serving as a pipeline to you to meet your need for healthcare workers as well. So I'm really confident, and I think Keith and Ashley would say this as well, is that we are here to graduate a student so that our graduates are practice ready, so that they can step into your settings and be ready and prepared to work in a team-based setting to really meet the needs of your patients, your other healthcare practitioners, and really help deliver exceptional outcomes here in the DFW area. Keith, I know you've got a couple of pieces here too on this.
Yes, so similarly, we had 76% of our students have at least one placement in the Dallas-Fort Worth area. Our students came to the Dallas-Fort Worth area to be in school here, and they would like to stay here. So one of the things that we're really trying to focus on is getting clinical affiliations, having enough occupational therapists in the community to be able to teach our students. These are educational experiences for our students before they're able to graduate, and what better place to be than in a hospital right here in your backyard, to where students aren't having to move across the country to seek something that could be offered right here and ultimately benefit the community that they live in.
I couldn't agree more. I mean, being able to train our students, I say train and retain. That's the SLP coming out in me, but that train and retain, that community involvement is a major impact factor for our students. So that whenever we're thinking about what the workforce looks like in our area, it's us making those connections, supporting our students to make those connections in our area. They feel welcomed here. We have a beautiful area in the North Texas region. I came here 2 years ago to this area, and I am very, very lucky to have landed here. Keith, I know you're born and bred, and so he's showing me all of the ways. But definitely with our students, if we can graduate students who are community oriented and have that community oriented mindset that they can actively involve themselves in the community, we'll be able to retain them to be able to work in our community, to be able to give back to those areas that make their, as I say, their clinical heartbeat. And so with that, when we're working with our students, when you're working with our students in our area and providing them with those experiences out in the field, they are able to explore with you what that looks like, what that job satisfaction looks like. They feed off of those pieces with you to be able to say, yes, this is my community, this is where I belong, and this is where I'm going to stay. And that's one thing that Keith and Tom and I talk about, and that we talk about as a university at large, is while we today, this afternoon, are talking about the clinical training impact, we also are really aware of the community impact that this has. And I know that we're talking at a hospital council perspective, but I know that each of us are also sending our students out into the schools, the local schools. I know that our SLP students have a school rotation. Our SLP students have an adult rotation, which is typically in these hospital environments, and then pediatric rotations, so things such as the NICU. And when when students are able to come to us and say, I'm really interested in a rotation in an NICU unit, because that's really where my heart is, if we're able to give them that experience in our community and they fall in love with the hospital, they fall in love with your NICU unit, they're gonna stay. And so I think about, while this is not the primary focus of USA, but I think about the economical impact. I think about the growth in our area and how that keeps these people here, keeps our students here, and continues to benefit everybody that lives in this community. Gentlemen, do you have anything to offer to those types of thoughts as well?
I think you said it well. I think that as we do our part to graduate competent new graduates to enter the field, then we, along with you, can only continue to build healthcare in the North Texas area to see that this area is truly leading in the nation on the delivery of healthcare in the United States.
Our students are also looking for volunteer opportunities. So for example, some things that they have done last October, USAHS students made adaptive costumes they partnered with a local elementary school in Capel. And there they made adaptive costumes for the students there that maybe were wheelchair bound or were just unable to have their own costumes for Halloween. We also have partnered with a local domestic violence shelter where students were able to have a clinical placement in that site, which then led into our capstone project. So our students are available to do research and do program development and things within the community that's part of them receiving their doctoral degree in occupational therapy. Within that same shelter, they were able to apply for a grant, and now one of our graduates is a full-time occupational therapist in that facility that they've never had before. So a lot of that was just through the experience and wanting to make an impact in the community and ultimately creating a job for themselves.
Keith, I love hearing you say that. That's a really good other point to bring up. Tom, you know what I'm thinking about too? I'm thinking about, well, we're talking a lot about this educational model and the clinical training model, but we just recently opened our doors yesterday to have a geriatric fair. And that was really amazing. And thank you, DFW Hospital Council, for disseminating that out, because that's really what we hope to be able to have, that synchronicity with our community, to be able to say, here's free healthcare screening. Please come in and have these opportunities that our students have put together in these really innovative ways. Keith, your costume design, I think about a children's hospital and how our students would love to be able to go to a children's hospital and do something like that. I mean, Keith, that's what really just kind of sparks my interest. And Tom, I know that the whole geriatric fair that was put together, we'd love to be able to have the students meet the community come in. Tom, do you want to talk any about the geriatric fair yesterday as well?
Yeah, wonderful. We appreciate, as Ashley said, that you helped disseminate our information on the geriatric fair. It's part of one of our courses, the geriatrics course. But beyond that, it allows the students during their time, here at school to be interacting with the community and interacting with people. So they're not just working on one another who are maybe simulating balance problems, but they can actually be there to work with some of our geriatric and senior folks here in the greater DFW area. With that, we've got plans in the works to work with some other outpatient clinics here in the area. Some of those that are seeing folks primarily with Parkinson's, Alzheimer's, all sorts of movement disorders, the traumatic brain injury here of network here of North Texas. And as Keith was saying, our students, all of our programs have student organizations, and all of those students, and this generation in particular, strives to give back and volunteer their time in the community. So we are always looking for opportunities where we can then share those opportunities with our student organizations, and then be able to adopt an effort, raise funds for. They raise funds for their own, initiatives and charitable institutions, but charitable gives, but that also allows them to then work directly with members like yourself in the community. Because that then, if we build that community and that sense of belonging here in the DFW area, then our graduates are more likely to say, upon graduation, I want to stay right here and build healthcare here in the DFW area.
Tom, that was beautifully said. And really, that's a great way for us to say that is really the heart of what we are in the North Texas region here at the Dallas campus through USA. Thank you for that, Tom. We are very mindful of your time, and we want to be able to give you all an opportunity to bounce any questions off of us or anything to that. Any questions or comments for us?
Yeah, thanks, Ashley. This is Steve. For people that do have questions, please put them in the question box. We're taking written questions. And Ashley, here's the first one that was in the question box. You mentioned a lot about simulation and preparing your students, whether it be PT, occupational therapy, or speech pathology. If there are any providers that would like to work with you on doing clinical rotations with your students, who should they contact? You or Keith or Thomas?
Steve, love, I'm so grateful you asked that question, and we came prepared with the answer. We would love to hear from you. And so, yes, all of the above, any of the above. If you're interested, on the left-hand side, if you're interested in affiliating with the university to be able to support one of our students out in the field work or internship, please reach out to any one of these CSDRs, the contract specialist reps. For our program-specific items, our information's on the right-hand side, and so reach out to us. But honestly, too, we work so closely together, Tom, Keith, and I. We are happy to speak to anyone, and we will also bring each other in. We're very open to, Steve Love, you've come have lunch with us. We're very open to lunch downstairs at this university. We would love to sit down at a table and talk to you about what you have to offer. And we also are planning some other events on the campus to give you guys out in the community the opportunity to come in and see what the university is, how the university is designed, be able to see our classrooms in action, the simulated experiences in action. So Steve, we'll continue to share those things with y'all as well.
Here's our second question. As we talk to young people that are thinking in terms of a career in physical therapy, occupational therapy, speech pathology, and we look to the future, what do you think the changes in that particular area of the workforce will change in the coming years?
Good question. You go first.
Want me to start it? I think we probably all have maybe a lot to say here. I can tell you that, as a university, we are, educating the next generation. We often say that, but we need to be at the forefront and ahead in our schooling. So I think digital health is definitely something that we are taking very seriously to have within our programs. And I don't mean just telehealth, telerehabilitation. I think many of us were launched into that probably sooner than later in healthcare, during the pandemic. But also, like, where are we going to be at with the use of artificial intelligence? Where are we going to be at with all the many artificial intelligence apps such as ChatGPT and all the others that are there, and that many today are seeking advice from? Do they go to Google Doctor, or who do they go to maybe for some of their guidance and advice? But we need to train our practitioners, our students, future practitioners, really how to help individuals navigate this amount of information that they can go through, realizing that maybe some of that really isn't the best medical advice for them. So I think we're looking at things of how to use artificial intelligence in our programs, in our courses, also looking at how to use virtual reality within our programs as well. So a lot of things on the forefront for us here at school to help prepare the practitioner for the future as well. Keith?
Yes, I think, for occupational therapy began with really a strong human connection. This was around World War I. And so I think it's important for us to continue to teach our students and to teach healthcare practitioners to make that human connection, to have conversations, to explore difficult topics with people. I think sometimes with today's generation, we move so fast and people don't connect the way that they used to. I think we need to continue to stress the importance of that in order to push healthcare forward and to make sure that we are remaining client-centered and being a holistic practitioner.
And Keith, that sort of reminded me about mental health as we work with our students on it, for them as a practitioner working with their patient clients, but for them themselves, being aware of their mental health. The pandemic taught us, I think, something, beyond which maybe we intended or needed to, but the mental health of today's healthcare practitioner should be on the forefront and top of mind for all of us today, because we lost a lot of folks, burnout, and it was a very trying time for many healthcare practitioners. And I think it brings that to the forefront in our educational programs. Thank you, Keith.
Yeah. Jennifer, you've raised your hand twice. We're not able to let you ask the question, but if you have a question, please type it in the question box. But you've raised your hand a couple of times, so we apologize. We have to do the questions through the box. And while we're waiting to see if Jennifer types that in, here is the one pending question we have. And Ashley, I'm not saying it's directed to you, but you mentioned that the University of St. Augustine and your health sciences is really coast to coast. But if you look specifically at the DFW campus, what are you excited about that you see on the horizon in health sciences that is truly going to be something that is going to be good for DFW?
Oh, Steve, I love that question. And I honestly think you've heard it through each and every one of us. Tom, Keith, and I, at the heart of what we're building out on this campus is community. We're building out community for our students, and we're really, really trying to build up community out into the community. I'll say it again, my goal at USA is to train and retain so that we can really build that sense of community and accomplishment and really be able to have these partnerships within the community. Steve, that's really at the heart of what my goal is. Keith and Tom, what are y'all?
I agree, and I think, nothing would please me, and I think all of us more than to see, you as a hospital group, or our outpatient groups, or our schools, our home health, agencies in the area, to really, have one of our alums working in your companies, your corporations, your practices, to really be helping shape healthcare of the future here in DFW.
I think for me as well, it's all about our students and helping them to achieve their goals of becoming a practitioner. I see some of our students are on the call today, so I know that it's very important for us to teach and to be able to give our experiences so that they can go make an impact in the community and to have the jobs that they dream of having, to be able to change lives. It's so important for therapists to have those moments of impact with their clients when they're meeting people in some of the lowest points of their life, and to hear stories from our graduates and from our current students about how they help them through that. I think that is why we do what we do.
Excellent. And we have our final question, and it's an excellent question. As we know, recently there's a study that shows 63% burnout, especially in healthcare workers. What is St. Augustine doing, not only for current students, but helping them deal with burnout as they enter the workforce?
That's a really good question. Guys, y'all mind if I jump in on this one first? I know for us, as we build out our curriculum, we are addressing mental health, we are addressing stress, we are addressing burnout, advocacy. And so each one of those are interwoven into our curriculum. And I would say, Steve, if you catch us on the right day, you're going to see Dr. Werner himself out there doing Pilates class with our students. So we really have a holistic training approach for our students, where it's not just a classroom, it's not just a simulation, it's not just clinical, it's a family and a community. And so I know, Tom, thanks for letting me put that plug in there for you. But I know, like in SLP, we have mindfulness training regularly with our students. Student services is going to have a wellness day. And so, Tom and Keith, how do y'all weave that into y'all's curriculum too?
Well, I think it's a wonderful question, and I think it starts also with myself, Keith, and Ashley role modeling, and then with our faculty, the faculty role modeling with the students. We must shine a light on healthcare. We must make it known that we're not afraid to talk about feelings and emotions, and that students should be talking about that now, but also as a future practitioner, we've got to be able to say that we got to be able to have an individual that can go forward into the workplace and feel comfortable with talking about it. Because if we can't talk about it, we can't shine a light on it, and we can't help it. And before you know it, the individual has reached burnout, and they're saying they're walking out the door, when this could have probably have been addressed a year or more in advance. So I think that's the key there. And if we can meet those shortages, we should be able to have more practitioners out there so that people aren't feeling that the work demand far exceeds their ability. And how many people can we see in X amount of hours? We're all aware of productivity in healthcare. It is a business, but we do have to be very sensitive to that.
Yeah, I think we're getting really close on time, but there was a follow-up to that, and they said they really appreciated what you're doing with the students. Are you doing anything to help current providers and their staff as you interact with them with burnout?
If you do engage with us as a clinical partner at USA, you are provided with a continuing education stipend. And so we can direct some of those stipends to that type of continuing education. We also at USA, Tom and Keith, y'all might be able to speak a little bit more to this, what Lori Hankins doing in her area with the continuing education and the training programs and availability of those things as well for current practitioners.
Well, I want to thank y'all. I know we've run a little bit over, but what a great discussion, great questions. And the DFW Hospital Council would like to thank Ashley, Keith, and Thomas for a very excellent presentation. And we really appreciate the way that you have talked about how you want to give back to the community and retain people in the DFW area. So this will conclude this webinar, but we thank you for your excellent presentation.
Thank you very much. We appreciate spending time with y'all this afternoon. Please reach out and become part of the community. Thank you, everyone.